Good morning, everybody. My name is Clarence Napier, the multi-state insurance broker, licensed in 12 states, including Washington State, California, Texas, Alabama, Georgia, Florida, South Carolina, Virginia, Maryland, Pennsylvania, Ohio, and Michigan. Today is October 24th, 2025, and we are on day 8 of the Medicare annual enrollment. And today's stories or events from yesterday take us to Miami-Dade, Florida, and the suburbs of West Philadelphia. So I just want to let people know that as a Medicare agent and insurance broker, my experience goes back to the early 90s, where I spent all but 3 years working in management and claims processing, grievances and appeals, sales, operations, call center. So I've seen a lot of insurance activity, but primarily one of my jobs was working in the appeals and grievance department for a Fortune 500 insurance company based in Los Angeles. And as an appeals and grievance coordinator, what I had to do was look at the appeals and grievances that healthcare members were submitting. Now, the thing people need to know about the appeals process when it comes to Medicare or even individual health insurance under the Affordable Care Act is that members do have the right to appeal. And an appeal is pretty much you disagree with a denial of coverage, you disagree with the level of coverage. Perhaps there's a prescription drug that your doctor says that you need, and for some reason it didn't get approved, or the quantity or the time to take the drug did not get approved. Well, you have a right as an insurance member to file an appeal. So this takes me to Miami-Dade. We have a member who was on disability, and now they're eligible for Medicare, and they are on Medicare. And before the person was on Medicare, they were on Medicaid. And Medicaid benefits are a little bit more lenient and a little bit more plentiful than Medicare in some cases. So this person still has the same situation, the same type of medical condition they had when they were on disability. Now they're on Medicare, they have the same type of situation. So drugs on Medicare, prescription drugs I'm talking about, were very, very affordable on Medicaid. And now that the person's on Medicare, sometimes the co-payments kick in, $5, $10, $15 to see a specialist, sometimes $15, $20, $35, depending on the plan. So this person, even though they knew that they would have expenses, these expenses are cutting into their living situation, their budget. But there is a way to request members who are experiencing budget issues, because it still takes money to live on Medicare. So, but if the expenses, co-pays, deductibles, hospital, inpatient stays are getting too overwhelming, and this has to be realistic. It can't be, well, I have the money, but I'd rather spend the money on something else. It has to be kind of realistic. So there's a way to help people at least apply for a determination to have some of these expenses lowered, sometimes back to the Medicaid level, even though their income may prohibit them from qualifying for Medicaid. So that's the first story. So I'm working on that. The second case is a little bit more complex. This is a Medicare member who is not my client, somebody that's a good friend. out of West Philadelphia, or the west of the Philadelphia metropolitan area, also on disability, now on Medicare. Now, the thing that people need to know about eligibility, Medicaid eligibility, sometimes the amount, like if you're getting a monthly check from Social Security and your Medicaid status is based on your monthly income. So if your monthly income increases, sometimes that puts you out of eligibility to receive Medicaid. So this happened to this person. The cost of living increase kicked in, and it pushed the members' income above the level where they used to qualify for Medicaid, Medicare. Now they do not qualify for Medicare, Medicaid. And in Medicare terms, this is called dual eligibility. Dual eligibility. So this person is really not doing well health-wise, but they were getting Medicaid benefits under the Medicare plan, under the dual program, dual insurance plan. So they were taken out of the dual eligibility plan and put into a standard Medicare plan with co-pays and deductibles. So this put this person budget and lifestyle and expenses above what they were paying before. So also the good news is, there are groups of people in the Medicaid organization in each state that will review individual cases for members who are experiencing severe financial hardship. Sometimes the cancellation of Medicaid eligibility may even put the person's health at risk, because now, medications and deductibles and hospital copays may put their mental state at risk, as well as not being able to pay some of the things that they used to pay for when they had Medicaid. So there is a process to work with people and to communicate with the Medicaid staff in each state to let them hear your case, and it's pretty much the appeal process. Now, the interesting thing about this member who's west of Philadelphia, west of the metro Philadelphia area, this person has an agent. And this agent is not helping the member, because yours truly, Clarence Napier, the multi-state insurance broker, has the experience, and I know what to do. I'm going to work with this person to help them try to see if they can get their Medicaid back. Now, I am not the member's agent. And for me, even if I'm not the member's agent, I still want to help, because this person's been a friend of mine for 10 years. So anyway, that's the latest on day 8, Medicare annual enrollment. And day 8 took us to Miami-Dade, Florida, and the suburbs west of metropolitan Philadelphia. My number is 866-901-9876. If you're looking for a broker, a Medicare agent that knows what's going on and knows how to put you on the right track to solve some Medicare issues that you're having with the plan, with the doctor, with co-pays and deductibles, please give me a call. Again, Clarence Napier, 866-901-9876. Our website is bestinsuranceplanning.com. Take care and have a great day.